co-founder of Neuright Inc. To give you a better idea of what our company does, I'd like to share a story with you about Eileen. Eileen was on her way to Denny's one day and about to park when, instead of parking, she drives into the restaurant. Now, Eileen didn't drive into the restaurant because she was texting. She drove into the restaurant because she couldn't feel her feet. And while she thought she was hitting the brake, she was actually hitting the gas pedal. This happened because Eileen had peripheral neuropathy, a disease that caused her to lose sensation in her feet. And Eileen had peripheral neuropathy partially because of her age, but also because she had diabetes. At Neuright Inc., our goal is to prevent people like Eileen from suffering a similar fate. Over 100 million individuals in the United States are suffering from diabetes or prediabetes. Over 60% of these individuals will develop peripheral neuropathy, which is a disease that causes the nerve in your skin to die back and retreat underneath your skin, causing pain, numbness, loss of sensation, and function. This costs us $30 billion per year in healthcare costs. And although there is no cure for peripheral neuropathy, catching the disease early does offer the possibility of intervention at a point when the disease can be halted and possibly reversed. However, there is a problem. There is no good early diagnostic tool for peripheral neuropathy. This is where we come in with a solution. We are offering the only device to combine early reliable diagnosis of peripheral neuropathy with the capability of delivering treatments and therapies as they become available, combined in a low-cost point-of-care device. So how do we do this? In this illustration, you can see the skin of your body starting from the surface layer, going all the way down to the tissues underneath. In a healthy individual, nerve fibers extend from underneath your tissues, going all the way to the skin surface. As peripheral neuropathy progresses, these nerves begin to die back. Now, our device is able to detect nerve electrical activity starting from the moment where your nerves are still healthy, going all the way to the point when nerves have retreated below the skin surface. While we can detect neuropathy as early as this stage, our competition can only detect it there. Looking at our competitive advantage, we realize we are the only product to offer early detection in a reliable and accurate way by measuring nerve electrical activity. We are also offering this at a very low cost. The standard cost of detecting neuropathy at a later stage than we can do is around $1,000 to $2,000. We are offering this diagnostic at a couple of hundred. Furthermore, we are primed to deliver treatments as they become available through our research and the research of others. The market right now shows that there are 30 medical conditions that can cause peripheral neuropathy. Over 20 million individuals in the United States alone are suffering from this disease. Because our device is small, minimally invasive, cheap to produce, and because we are partnering with device manufacturers, we are primed to penetrate the diabetic point-of-care market, a market that's expected to reach $25 billion in revenue by 2024. Making our company a success is our interdisciplinary team. I received my PhD in biomedical science at the University of Maine. Before that, I worked for 10 years in a biomedical device startup company in Boston. Our other co-founder, Christy Townsend, is a neuroscientist with expertise in diabetes. Together with neurophysiologists, we represent 40 years of neuroscience experience. We are combining that with over 70 years of engineering experience in microfabrication, signal amplification, and wireless communication development. Together with Derek Hautman, who happens to be the grandson of Eileen, he comes in with 15 years of experience in business, sales, marketing, and organization. So far, we have amassed over $100,000 in non-dilutive funding. This has allowed us to take our product from the bench, bring it through customer discovery market research, and create our company. Right now, we are filing IP and testing our prototype, putting it through clinical validation. $25,000 will allow us to finish preclinical validation and bring our minimum viable product through clinical trials. At that point, by 2023, we expect our product to be market ready and be able to distribute it to thought leaders through the nation. And while they test our product and see how good it is, we can work on developing therapeutics. Thank you for listening.